On this Wednesday night, Nova Scotia shuts down.
We need your help to slow the spread.
What's gone wrong in a province that was once the envy of the country? New insight into how Ontario failed long-term care homes as that province unveils a plan for paid sick leave. Cutting surgeries, Alberta's sacrifice to help hospitals full of COVID patients. The misconduct allegations into General Jonathan Vance, the investigation military police wanted to end years ago. And he kept solitary watch in the capsule as others walked on the moon.
We crew felt the weight of the world on our shoulders.
Tributes to astronaut Michael Collins.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin tonight in Alberta, where there is growing pressure on the Premier. Yesterday, that province hit a record 11.4% positivity rate. Variants are spreading fast, hospitals are filling up, and now scheduled surgeries are being reduced. And heartbreaking stories are emerging of younger people getting sick. Heather Yourex-West has our top story about one family mourning the sudden death of their teenage daughter.
17-year-old Sarah Slate began suffering from a sore throat last week. Her sister had tested positive for COVID-19, so she had been isolating at home. Her first COVID test came back negative, but when her condition worsened, her family called 911. The teen died in hospital on Monday. Her father believes COVID-19 was to blame. Well, the number of COVID patients in hospital is still well below Alberta's second wave peak. A greater number of those patients are requiring intensive care, and ICUs are nearly as full as they were back in December.
It does create some cause for concern, given that we know there's more to come, just based on simple mathematics with the numbers that we're seeing.
In Calgary, Edmonton, and across northern Alberta, 30% of non-urgent surgeries are now being postponed. Even more procedures have had to be cancelled in hard-hit Fort McMurray. Northern Alberta Indigenous groups say more restrictions are needed to protect the health system from being overwhelmed.
It's a fiasco. It's a mess. It's it's astonishing that the Alberta government, with everything that they have before them, they dropped the ball on Fort McMurray. Wood Buffalo region.
The province says it will send more vaccine to the area. For the next 2 weeks, doses of the Johnson & Johnson vaccine will head to the hard-hit regions of Wood Buffalo and Banff. Adults as young as 30 will become eligible for the AstraZeneca vaccine here too, all in an effort to protect more essential workers. According to Alberta Health, there are active outbreaks at 12 oil sands work sites, accounting for more than 700 active cases, with 40% of infections reported at the Horizon site operated by Canadian Natural Resources. Angela Johansson's dad works at Horizon and has been sick for the last 9 days.
Since the 19th, he's been in an isolation room at the camp at Fort McMurray. They told him there's 200 people they got to take care of, so they can't give him any special requests because he asked for some soup.
Just one of more than 20,000 Albertans who are ill as the province battles its third wave. Heather Yourex-West, Global News, Calgary.
The first doses of the Johnson & Johnson vaccine have now arrived in Canada. Roughly 300,000 doses landed this afternoon at Toronto's Pearson Airport. The doses arrived frozen and they must be thawed before they're shipped to the provinces next week. The Alberta government plans to send its share of those doses to specific areas. Premier Jason Kenney says shipments expected in the next 2 weeks will go to two hard-hit communities, Banff and the municipality of Wood Buffalo, and everyone aged 30 and up will be able to get them.
Accelerating the vaccination program in those communities, which also happen to have younger populations, would be helpful in addressing the outbreaks.
In Ontario, after months of pressure from the public and its own science and medical experts, the Ontario government has unveiled a plan for a paid sick leave program. It's not in place yet. It needs legislation to be passed, but if that happens, it will allow for 3 paid sick days without the need for a sick note. Global's Queen's Park Bureau Chief Travis Dhanraj is with me. Travis, start with what's in this plan.
So this program is retroactive and goes from April 19th to September 25th. It will cover 3 paid sick days for part-time and full-time workers. The program will be administered by the WSIB, that is the Workplace Safety Insurance Board. Payments will be up to $200 a day, and a worker will be eligible if they're sick, they have symptoms, they need to get vaccinated, or are waiting in isolation for results. Here's what the Minister of Labour said for Ontario, Monty McNaughton, and also Andrea Horvath, the leader of Ontario's NDP.
Well, look, we're leading Canada when it comes to protecting workers. We're bringing in protections for 3 paid sick days. The federal program runs for 4 weeks. We're there for workers through this entire pandemic.
I mean, 3 days of paid leave is paid sick leave is it's better than none. But I don't know where the Premier thinks that this is the best paid sick days program in North America. It certainly is not.
Travis, Ontario wanted to piggyback on the federal sick leave program, and it's now talking to the feds about that, correct?
That is correct. They wanted to top up the federal program by $500 additional for a total of $1,000 a week. The feds said that they wanted to see a provincial program first. Now that has happened, so the ball right now in Ottawa's court, Donna.
All right, Travis Dhanraj in Toronto, thanks. In Ontario, a provincial emergency order has been amended, allowing hospitals to transfer chronically ill patients from hospitals into long-term care homes without their consent to free up hospital beds.
This temporary emergency order will provide hospitals with the flexibility to transfer certain patients, those whose doctors have determined no longer require hospital care and could be better supported in a more appropriate setting, to a long-term care or retirement home. This would be done in only the most urgent of situations.
Ontario's Health Minister Christine Elliott says hundreds of patients in hospital are waiting to be discharged to a long-term care home. She says patients or their families will be consulted, but there may be rare situations where a patient is moved without consent. The order is being criticized. There are fears people will be railroaded into homes they don't want to be in. Plus, care homes have serious staff shortages. One bioethicist, though, says this.
I do think we have no choice, and I do think it's justified. I just hope and believe that people will move heaven and earth to try and get consent from all the many people involved with this. And I believe they will.
We know the terrible consequences of the pandemic on residents in long-term care in Canada. Today, Ontario's Auditor General made the failures clear. By the time COVID-19 started to ravage care homes last March, she says the system was not prepared or equipped, and it was obvious aggressive infection prevention, detection, and patient care actions were needed and needed quickly to prevent staggering death rates. That didn't happen. Nearly 3,800 residents and 11 staff members in Ontario's long-term care system have died since the pandemic began. And the second wave hit Ontario care homes harder than the first. Eric Sorensen looks at the multiple failures in a sector that has long been neglected.
Long-term care residents rushed into ambulances couldn't fully convey the horror inside long-term care homes. Overcrowded rooms, insufficient staffing, and a virus running rampant. The Auditor General says neither the government nor the long-term care sector itself was sufficiently prepared for the pandemic or equipped to respond. In fact, some patients with COVID-19 at first were transferred into long-term care homes.
I would say there could have been more clarity and guidance. The safety of residents in the long-term care homes needs to be considered.
The government acknowledges long-term care should have played a bigger role in the initial healthcare response.
We have to have a much better integrated system where long-term care is seen to be part of the healthcare sector as a whole.
And there were unintended consequences. Families were kept from visiting to curb the spread of the virus, but, says the report, it had the effect of further limiting care providers. Maureen McDermott could only wave to her ailing mother inside.
Families bring in that attachment and that connection that's absolutely necessary. And the worst part for a child, I think, is to have their parents suffer in any way.
The report questioned a government decision to discontinue comprehensive inspections of long-term care homes to deal with a years-long backlog of complaints. On most findings, however, the minister blamed the previous Liberal government.
I'm here to try and fix long-term care. But if the building's on fire and you're running into it to try and save people, yeah, I think that's pretty much what we tried to do. But we didn't start the fire.
Advocates say the current government must accept its share of responsibility.
We knew that long-term care was going to be most susceptible, and this government stubbornly refused to take care of our most vulnerable.
The Auditor General says there has to be greater accountability, and it can be demonstrated by ensuring seniors will be cared for appropriately in the future. Eric Sorensen, Global News, Toronto.
In Nova Scotia, it is day one of a 2-week province-wide lockdown. Daily new cases of COVID-19 reached record levels there this week. There was a slight drop today, though, 75 new cases compared to 96 yesterday.
I, too, am pleased to see that our case numbers have gone down, but it is only one day. It's quite possible they may go back up again tomorrow. What we want and what we're looking for is a sustained downward trend.
Nova Scotia is now opening up appointments for the AstraZeneca Oxford vaccine to people aged 40 to 54. That'll happen later this week. 26% of Nova Scotians have had at least one vaccine dose now. The national average is about 31%. For months, Nova Scotia had so few cases it was the envy of much of the country. But as Jesse Thomas explains, what's happening now is a reminder how quickly things can change.
3 weeks ago, the focus in Nova Scotia was on the potential reemergence of the Atlantic bubble. That would allow residents of New Brunswick, PEI, Nova Scotia, and Newfoundland and Labrador to travel freely between provinces again without having to quarantine. But on Tuesday, Nova Scotia announced it was going into a full province-wide lockdown. How did things change so fast?
Variant virus got into the province. That's number one. I think we found it fairly quickly, because we were doing a fair amount of testing.
Nova Scotia had been the envy of the rest of Canada with minimal cases and few restrictions. The province opened its borders to the rest of Atlantic Canada on April 7th, and at the same time allowed retail establishments and restaurants to return to 100% capacity.
Because we were at an enviable place of having fewer restrictions, it was able to spread and to go into community fairly quickly.
On day one of the lockdown, it was noticeably quiet in downtown Halifax. Most retail businesses have been forced to close. Only essential businesses like grocery stores can remain open at 25% capacity. The doors have closed at Dear Friend, a cocktail and wine bar that opened last summer. Owner Matt Boyle has had to lay off his staff a third time. His new business doesn't qualify for many of the government benefits.
If you don't have comparables, you can't show reduction. So we don't qualify for the wage subsidy. We don't qualify for a lot of the emergency benefits out there.
Nova Scotia tested more than 10,000 residents on Tuesday. That's been one of the province's best strategies in containing the virus, says Barrett.
We want to keep our testing higher than anywhere else in Canada per capita at the beginning of the outbreak before it gets out of control.
74 members of the Canadian Armed Forces have been deployed across the province to offer support at testing sites. This week alone, 168 Nova Scotia health employees have had to self-isolate as per COVID-19 protocols. Jesse Thomas, Global News, Halifax.
Global News has uncovered exclusive new details about a decision back in 2015 to name General Jonathan Vance as Canada's top soldier. He was appointed Chief of the Defence Staff by the Conservative government of Stephen Harper. And when Vance was sworn in, an investigation was underway into his conduct overseas. Now, new documents reveal that within hours of Vance taking command, military police recommended ending that investigation. Mike LeCouture explains.
At the same time as General Jonathan Vance was being sworn in as the Chief of the Defence Staff in 2015, a military police investigation of him was still technically open. That's according to documents obtained by Global News through access to information laws. The investigation was looking into Vance's conduct while serving as Deputy Commander of NATO-allied Joint Force Command in Naples, Italy, a position he held from 2013 until July 2014. The 455-page, heavily redacted document shows two brief references to concluding the investigation. Global News has confirmed with the Department of National Defense the recommendation to end the investigation came on July 17th, the same day Vance was being sworn in as the country's top soldier. 4 days later, military police approved the end of the investigation.
There had been no reprimand of the general.
The former Chief of Staff to then Prime Minister Stephen Harper, Ray Novak, testified before a Commons committee last month about Vance's appointment.
We were briefed that the email alleged an inappropriate relationship during the general's time at NATO, but contained no new information.
Novak testified that it still triggered a review by the military police. However, a week later, Harper's national security advisor told the Prime Minister no further information regarding the allegation was found. There remain questions about the chain of command and the military police's ability to investigate sexual misconduct cases, let alone one involving Canada's former top soldier. One of the women at the heart of the allegations against Vance says the former CDS told her he was above investigation.
The CDS told me he was untouchable. He owned the CFNIS.
All of this comes as Prime Minister Justin Trudeau claims no one in his office knew allegations about Vance were a, quote, Me Too complaint. Opposition parties are pushing to have his Chief of Staff, Katie Telford, testify before a Commons committee. Mike Lecouteur, Global News, Ottawa.
India's deepening disaster coming up. Sickness and death is everywhere as countries rush to help. In India, COVID-19 is still spreading unchecked. In just 24 hours, another record, more than 360,000 new infections reported and more than 3,000 reported deaths. The real number is believed to be even higher. India's official death toll is now more than 200,000. Crystal Gamansing reports.
His last visit to Canada was a few years ago. Suryakant Patel's nephew thought he was going to be okay, but Babu, as he called him, didn't make it.
So he was, somebody who always used to WhatsApp us jokes and things like that. So he was very active still, still a big part of our lives despite being far away.
The struggles in India are profound and heartbreaking. People are lining up for hours and paying random inflated prices for oxygen, desperate to save their loved ones. And death doesn't end the nightmare. Crematoriums around the country can't keep up.
I have right now 14 relatives in India that are actively infected with COVID. Some of those are in healthcare, and so I'm getting firsthand accounts, and everything you see on TV, it's even that doesn't relate how desperate the situation is in the big cities.
There are 3 known virus variants circulating, but testing and sequencing are inadequate, so the extent of the virus in India is unknown.
I feel like I'm running a clinic on WhatsApp, honestly, with all these different chat groups, and what's your latest saturation? They're sending me their CT scan on WhatsApp.
2 doctors who know the virus and feel helpless.
One of the troubling things for me is that he did die alone without any family there, which, as an ICU doctor, I've seen, unfortunately, many times. And it's definitely been the hardest part of this.
A gut-wrenching experience for far too many. Crystal Gamansing, Global News, London.
Ahead, what members of the Canadian Military Police wrote online about a woman accusing a top soldier of misconduct. There's a disturbing new development tonight involving the sexual misconduct allegations within the Canadian military. A flood of memes and comments in a private Facebook group disparage one of the women at the heart of the accusations. The group includes both past and present members of the Canadian Military Police, the very team investigating 2 defense chiefs, including General Jonathan Vance. Vance has denied all allegations of inappropriate behavior, including a claim from Kelly Brennan that he fathered 2 of her children. Abigail Beeman has the story and a warning there is some bad language in it.
Discipline by example, Canada's military police motto. But facing 2 of its most sensitive investigations yet, the question is, what kind of example? A string of comments in a private Facebook group for current and former officers mocks testimony by Major Kelly Brennan, one of the women alleging sexual misconduct by former Defence Chief General Jonathan Vance. If you sleep with a senior rank, you get good postings and promotion to support the bastards, but no parenting and support from the senior rank, reads one. Multiple memes and GIFs, too. Giggity is a catchphrase from the TV show Family Guy used to express sexual excitement. A military police spokesperson tells Global News they're aware of the comments and the matter is currently under review. Survivors of sexual misconduct in the Canadian Forces and others question whether military police should be trusted to handle sexual misconduct cases, let alone one involving the country's former top soldier.
They don't have the independence of a professional police force, a civilian police force.
Stu Kellogg served 40 years with the Canadian Forces Reserve, including 30 with the military police. He says every decision they make is influenced by the chain of command.
These are very dedicated, hardworking, and committed individuals who try to do the right thing. But unfortunately, their chain of command often comes as an obstruction to that.
It's heartbreaking.
Policing expert Christian Luprecht says the Facebook comments re-victimize those involved.
It's exactly the sort of discourse that civilian police forces have fought really hard to root out from their organizations.
He says change has to come from the top, starting with Defence Minister Harjit Sajjan.
We need the ministers to step in and draw some clear red lines.
A government source told Global News military police have not found any currently serving military police officers among those who posted the comments. Abigail Beeman, Global News, Ottawa.
He kept a watchful eye while his colleagues made one giant leap for mankind, next remembering the forgotten astronaut. A former astronaut who has been described as the loneliest man in history has died. Michael Collins stayed alone in the command module during the historic 1969 mission to the moon, while Neil Armstrong and Buzz Aldrin went on the first moonwalk. He said later the Earth looked like a fragile little thing you could obscure with your fingernail. The others got all the glory, but Collins was critical to that mission, and the tributes to him today make that clear. David Aiken reports.
It's one small step for man.
While Neil Armstrong was taking that giant leap for mankind, Michael Collins, then 38 years old, was by himself in the command module, flying circles around the dark side of the moon. Collins, Armstrong, and Buzz Aldrin were the three-man crew in the most famous flight in history, the one that carried human beings to the surface of the moon for the first time. And for most of that mission, Collins was the pilot.
Basically, he was in the mothership, making sure everything worked. An absolutely vital role. He was the keystone of that mission.
Yes, indeed. They've got the flag up now.
Collins never griped about missing his chance to walk on the moon, or the fame and glory that came to Armstrong and Aldrin.
The thing I remember most is the view of planet Earth from a great distance. Tiny, very shiny, blue and white, bright, beautiful, serene, and fragile.
Mike was wise enough to see that his place in history was very important, but he wasn't going to go along with some of the ridiculous celebrity that can come with that. He was the perfect person to be on that first mission.
Collins will also be remembered for his 1974 autobiography, Carrying the Fire, widely considered the best account of spaceflight ever penned by one who flew.
People have this curiosity. They want to know about the universe. They want to know more about how it works, how it affects their lives.
Collins may not have walked on the moon, but he was the one who flew humanity there first and brought its first explorers home safely.
And that is Global National for this Wednesday. Buzz Aldrin is now the only surviving crew member of that Apollo 11 mission, and today he tweeted this. Dear Mike, wherever you have been or will be, you will always have the fire to carry us deftly to new heights and to the future. We will miss you. May you rest in peace. I'm Donna Friesen. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.